Hey everybody, I hope you've been enjoying our series on skin health. Dr. Brace here, it's Facial Plastics Friday, and we're going to finish the series today on elastin. But before I get into that, if you've been following along and playing our Easter egg hunt game, a lot of people are having trouble finding the secret word in last week's video. So the clue is look on the screen for a pop-up word somewhere in the bottom left of the screen, and that is the secret word. Also, watch this video carefully because there's going to be a secret word in here for another bonus entry. So, in the recap, when I spoke 2 weeks ago, we talked about collagen and what does collagen do for the skin. And collagen is that lattice network of polysaccharides that give the skin its structure and its support and its its integrity. Last week we talked about hyaluronic acid as the molecule made by the fibroblasts in the skin that bind water and give the skin its turgor pressure, its hydration, and it's some of its thickness. And today I want to talk about elastin because elastin is really important in our skin because it gives it the elastic recoil. If you think of a child's skin, if you pull on their skin in a small pinch, it will kind of snap right back to where it was. Where if you do that to your grandma or somebody in their 80s, the skin doesn't have the same elastic recoil, and that's because of loss of elastin. So elastin is a protein also made by the fibroblasts in the skin, and what we know about elastin is that we really start decreasing production of elastin in our skin in our 20s, and so from the kind of mid-20s onward, the elastin content of our skin decreases more and more. The other thing that happens is we get something called solar elastosis. If you were to take a biopsy of your skin at the age of, say, 16 and a biopsy of your skin at the age of 50 and look at it, the elastin that is present is more disorganized and doesn't work as well because it's not in nice layers the older you get. So that's from sun damage. And so what can you do to help your elastin? Well, the only FDA approved device that is a bipolar radiofrequency microneedling technology that helps make elastin is Profound. That's one of the reasons I brought it into our practice. And so this is our Profound machine. It's not on right now, but the dermal handpiece right here, that has 5 pairs of needles, and those needles enter the skin at a 25-degree angle, and they cause a zone of thermal injury between the needle points, and it's temperature controlled. So we know from studies on skin and on proteins that if you heat up proteins, it will denature them, kind of like if you're cooking an egg and it goes from clear to white. That's denaturation. If you denature the protein in the skin completely, you'll get scarring basically and pitting and bumpiness, kind of unevenness. But if you partially denature the collagen in the skin, you will get a wound healing response, which will make new collagen and new elastin and help stimulate hyaluronic acid because you're stimulating the fibroblasts. And so Profound is the only one that's been shown to induce this elastin formation in a bipolar radiofrequency technology. And so it's great. Now the thing to remember is that your elastin content is higher in your 20s and 30s, lower in your 40s, 50s, 60s, 70s. And so if you have loose hanging skin, Profound's never going to give you a facelift. It's never going to give you the tightening. At most, it gives you about a 30% increase in the skin tightness, but it also increases your skin hydration and your skin quality because of the collagen. And so it is a great skin health technology. I did Profound back in October. I'll be showing my pictures in the coming weeks at my 6-month mark, and it's really around my jawline where I've noticed the most tightening. But that's what Profound does. I would say that the ideal candidate for Profound would be somebody in their 30s and early 40s who wants to maintain the proteins in their skin, maintain the elastin, maintain the collagen, maintain the hyaluronic acid so that you can slow the process of aging. There's nothing that's non-surgical that will completely reverse the aging process, but you can slow down what's happening in your skin and make your skin look as healthy as possible, as hydrated, as thick as possible, tight as possible, non-surgically, using something like Profound. So that's what elastin is. Elastin is that elastic fiber protein in your skin that you lose from your 20s onward. Once you get to a certain point where it's really depleted, you really have to tighten the skin surgically to get a crisp jawline, to get rid of a turkey waddle, to get rid of loose kind of hanging cheeks. That's surgery. That's a facelift, neck lift. But if you want to stave that off and push that off as far as possible and keep your skin stimulated and healthy, then Profound is a great way to do that. People often ask me, how many treatments do you need with Profound? It is one treatment with 100% response rate, but that response rate is different for every people. So if you look at biopsies, everybody gets more collagen, more hyaluronic acid, more elastin, but not everybody gets the same degree of correction clinically when you look at their pictures. So at minimum, you'll get thicker, healthier, more hydrated skin. At best, you'll get 30% tightening with all the rest of the skin health benefits. So send your questions about Profound, send your questions about Elastin, and go back and look through this video and find the secret word for a bonus entry for the Easter egg hunt. Happy Easter, everybody. Have a great weekend, and happy Facial Plastics Friday.